From the Caesars Superdome in New Orleans, Louisiana, this is Ochsner Health Moonlight and Miracles Virtual Gala, presented by the Tom and Gayle Benson Foundation. Now, here's Ochsner Health Executive Vice President and Chief External Affairs Officer, David Gaines.
Good evening, and welcome to the 10th Annual Moonlight and Miracles Gala, benefiting the Ochsner Cancer Institute and the Gayle and Tom Benson Cancer Center. On behalf of our team, I thank you for your dedication to cancer care at Ochsner. We are so grateful to have you here with us tonight. We have a fantastic evening planned. We'll learn more about the vision of the Benson Cancer Center in New Orleans and about the Ochsner Cancer Institute throughout the entire region. We'll hear from Dr. Brian Moore and Emily Perch, our amazing, dedicated cancer care leaders, and about all the phenomenal work our team is doing to change and save lives across the entire Gulf South. We'll hear from our CEO, Pete November, our President and Chief Operating Officer, Mike Hulefeld, and our Chief Physician Executive, Dr. Robert Hart. And you'll hear about what makes the Ochsner Cancer Institute unique in our region and how it's contributing to improved health outcomes throughout our communities. We're also here from Mrs. Gayle Benson, our wonderful chair for tonight's event. Mrs. Benson has been a longtime champion of Ochsner and the entire New Orleans community. We couldn't be more grateful for her leadership and for her support. We'll also hear many stories from our patients tonight. Stories of resilience, of hope, of compassion, of survival. One story of survival is my own. I was diagnosed with stage 3 kidney cancer 2 years ago. This was the most devastating diagnosis of my life. But I'm so grateful that I had the Ochsner team behind me. I could have not asked for a better experience and a most incredible outcome. Today, I'm cancer-free. And all because of the work of the amazing physicians and the care team at the Benson Cancer Center. It's because of them that I'm here on this stage tonight. You'll also hear many inspiring stories about our Cancer Institute this evening, but one of the greatest things about our center is our namesake, Mrs. Gayle Benson. She and her late husband, Mr. Tom Benson, committed to Ochsner and to the community to help those in need, to help those who may otherwise have no hope. And since the founding of the Gayle and Tom Benson Cancer Center, Ochsner has saved countless lives, including my own. So without further ado, and with tremendous gratitude, please help me welcome to the stage, Gayle Benson.
Good evening, everyone. It is my humble honor to chair this important broadcast this evening. Since 2013, Moonlight and Miracles has raised nearly $20 million to support Ochsner's critical cancer research and innovations in patient care right here in New Orleans and throughout the Gulf South region. We aim to raise $2 million this evening, and we're counting on you to help us make a difference in the lives of the many people fighting cancer in our community. One of those people is my friend, Swin Cash, Vice President of Basketball Operations and Team Development for the New Orleans Pelicans. Please join me in watching her story now.
In 2007, I was having some back issues, and it was identified that I had a herniated disc. Well, I had went in because I was having even more pain to my back and got an MRI. And by the grace of God, the radiologist, while looking at this image of my back, noticed something on my kidney, and it was realized that that cyst was cancerous. Here, we're like 2 weeks out from the WNBA playoffs, and so then kind of my journey into trying to figure out what it looks like and how I deal with this and how we attack it, and also play in the playoffs if I could, was pretty much top of mind for me. By the grace of God and recognizing in a very early stage, I didn't have to get chemo. I didn't have to start any procedures right away. because they were going to wait until after my WNBA season finished. So I went through the playoffs in 2007 with this cyst and understanding that, and afterwards I was able to have surgery where they were able to go in and remove the cyst, and I wasn't in a great place physically for like another year or two. I didn't make the Olympic team in 2008, and so those next 4 years was so important to me. My drive, my commitment was to get back to the Olympic team in 2012. Because I didn't want to feel defeated. I didn't want to feel that my career had ended there. And so I started this journey of realizing what was important to me in life. Whenever you hear those words that there's cancer anywhere in your body, your vision becomes different. And that's what changed for me, is my vision became different, and what I wanted my life and my commitment to things that are greater than me. It went from maybe of just being here and you think you're doing good work in the world, and then you go through something like that and it just takes you to a whole nother level. During the journey when I was in it, and then even years afterwards when I would go back in for my yearly test and they would say, "You're fine." And that last test that you go in and they say, "Okay, we don't need to see you anymore, like you're good to go." Like, to me, that was pretty much one of those stages when they talk about ringing the bell when you're at the hospital. Like, it was more like a championship. And so you just live with this, but you continue your life and you continue to do good work. So that's what I try to pour my energy into my nonprofit, into Cash for Kids, into being an advocate for women and for at-risk youth. Those were kind of the things that really moved me and made me passionate about helping other people. What I like to tell other families is probably what Coach Green said last year in the playoffs.
Get your freaking hands up. This is what we live for. This is what we worked hard for. Okay, we ain't giving it up. We are not freaking giving this up. You gotta freaking fight. You gotta fight.
Like, you gotta fight. Doesn't matter what stage you're at, like, you gotta fight. And you gotta have that fire. You gotta find that fight inside of you.
Thank you for joining us for the 2022 Moonlight and Miracles Gala, benefiting the Ochsner Cancer Institute and the Benson Cancer Center.
We have an exciting evening ahead with several ways you can support the patients of Ochsner. Every dollar you give tonight will help a future cancer patient, and you too, through the life-saving research and care these donations support. You may think that hearing the words, "you have cancer," is the most frightening moment of a person's life, but it doesn't have to be. We are all here to help together, and that is what tonight is all about.
That's right, Lori. Tonight is a celebration of all the positive outcomes Ochsner has achieved for those across our community. Through its state-of-the-art facilities and its forward-looking approach to researching and identifying the best solutions to stop cancer in its tracks, Ochsner is leading the way in cancer care, while working just as hard to prevent it.
Before we introduce you to Ochsner's new CEO, I want to remind you that you can donate to our patients tonight by texting the number on your screen. And you can purchase a raffle ticket to win this beautiful Mercedes-Benz GLC. Now, please help me welcome to the stage Ochsner's Chief Executive Officer, Pete November.
Thank you, Lori and Mark. And thank you all for joining us tonight. Your generosity and commitment to the well-being of all the patients who walk through our doors for cancer care have helped Ochsner save the lives of countless people in the Gulf South and across the country. And thank you to everyone who has contributed to this extremely important cause and helped make our 10th annual Moonlight and Miracles so special. All of us look ahead after a challenging few years. We have a lot to celebrate. I'm proud of the Ochsner team and all that we've accomplished, even in the face of unprecedented circumstances. I am certain you will agree that the Gulf South is amazingly fortunate to have this world-class team of healthcare professionals caring for our friends, our families, our neighbors, no matter what gets thrown at us. Our teams are exactly why people all across the country travel here to Louisiana to be cared for at Ochsner. They come here because they know Ochsner is the destination for cancer care, and the home for medical advances, clinical trials, and innovations not available anywhere else in the Gulf South. Cancer is complex, from the diagnosis to the treatments, but cancer is also personal. To some, cancer can seem like an abstract threat, something we hear about but hope we don't experience ourselves. But when you receive that call and you find out that you or a loved one has cancer, it becomes very, very real and very frightening. I know this firsthand. My mother-in-law, Brenda, who we call B, was diagnosed with breast cancer in 2020. For anyone who knows me, I often say I have the best mother-in-law in the world. My mom passed away 20 years ago, so B has become a mother to me. She's the best grandmother to our children and is the kindest and most giving person I know. B, we love you. When B was diagnosed, we were all so devastated. Like many families, we had no idea what to expect. But once we met with Ochsner's team to discuss her diagnosis and her treatment, we knew there was so much hope. Let's take a look at B's story now.
My name is Brenda Stevens, and I am the mother-in-law of Pete November, who has just recently been named CEO of Ochsner Health. I'm very proud of him, needless to say. Well, it was the end of 2020. If that had not been a year to survive anyway, I began having symptoms and called my primary care doctor and said, I think maybe I need a mammogram. As the diagnosis progressed, from the mammogram to an ultrasound to a biopsy, you can't help but know that there is something going on. And I received a phone call on a Monday morning, early, with the diagnosis that it was breast cancer. I was by myself. I had to take a moment to let it all absorb. And then I immediately called my family, and we rallied around and decided, you know, this is something we can all research. We'll make positive decisions, we'll make educated decisions, and we'll go from there. Then I went to that beautiful cancer center. It was a very comforting feeling to go there. The comfort, I think, comes from your trust in the care that you're being given, the fact that they have researched, they know the right drugs, they're up to date with everything that is moving along in the cancer research. And it's just the combination of everyone that's going to take care of you, not just your doctor, not just the gal in the office that takes you back to your doctor. It's a whole group of people that have your health and their care, and that they're going to do everything they can to help you. I wake up every morning so happy that I've got a day. My treatment has altered some of my activity. I do have to plan, not to schedule, not to overschedule, and to take time to stop and rest. But I've been able to maintain my activities that are important to me. I'm a tremendous Saints fan, as we all are. And last year I kept thinking each time I could go to a game, ooh, I feel great, and I'm gonna get to go to this ball game, and I'm so grateful, and I'm gonna enjoy it. And then this season came along, and I'm still going to the ball games, and I'm still feeling great, and I'm thinking a year later, and here I am enjoying my Saints.
Brenda's story is like the story of many of our patients, full of hope and full of resilience. As you know, many of our cancer care experts at the Gayle and Tom Benson Cancer Center and across all our Ochsner Cancer Institute locations have been recognized nationally and internationally for their groundbreaking clinical care. But at Ochsner, our doctors and care teams also fully understand how difficult a cancer diagnosis is for our patients and their families, and that understanding shows through their compassionate care, helping patients and families get through the toughest time of their lives with dignity, with empathy, and with hope. saving and changing lives and keeping families together for more years to give them more cherished memories. This is why we do what we do. Now I'd like to share the story of my father and my family with you. Let's watch. We have all been touched by cancer, and as healthcare professionals at Ochsner, our doctors and care teams know cancer all too well. We also all know it personally. Dr. Robert Hart's wife, Susan, Pete November's mother-in-law, Brenda, and some of my closest friends at Ochsner have battled cancer themselves. Each one of us has our story. My story is my dad. My dad was my best friend, the person whose life I've tried to model mine after. 10 years ago, on Memorial Day weekend, he was diagnosed with an extremely aggressive form of mesothelioma. He lived in Cincinnati, so he wasn't treated at Ochsner. And honestly, the experience was at times an example of what not to do when a family's facing one of the most devastating times in their lives. The care he received was disconnected. For example, on the day he was diagnosed, the surgeon who did the biopsy came out, told my mom, my brothers, and I that we should get his things in order. And then later that afternoon, that same day, the medical oncologist who was going to care for him told us the surgeon never should have said that. We've treated this before, and it's a very manageable disease. So a lot of up and downs. There was not good communication. There were no navigators to help us manage everything that was happening to my dad. I believe he received some treatments that he probably shouldn't have, and to watch him go through this was painful. My mom was struggling, we all were. We called in hospice, not because anyone on my dad's treatment team assisted us and led us down that process, but because my mom was a retired hospice nurse, and she knew that his time with us was coming to an end. So the experience it didn't need to be that way. And that's not what we do here at Ochsner. At the Benson Cancer Center or any of our other incredible cancer facilities, our first priority is always the patient and their family. For example, we have over 50 navigators to help coordinate care for our patients and their families. We have clear pathways to treatment and protocols based on national best practices. We have multidisciplinary clinics where oncologists, surgeons, radiation oncologists, medical specialists all come together to diagnose, plan, coordinate care, and treat our patients. I don't know if my dad's outcome would have been any different if he were treated at Ochsner, but I do know it would have felt different. More coordinated, more compassionate, more kind. I know that if he were treated at Ochsner, my mom, my brothers, and I would have different memories of the end of my dad's life. My goal is to make sure that every family that comes to Ochsner has the opportunity to get the best cancer care in the country with the best possible experience for the patient and for their family. And I want to thank you, our donors, for helping make our cancer program so great. Because of you, we have incredible state-of-the-art facilities. Because of you, we have the best, most coordinated cancer program in the region. And because of you, our patients and their families have the best care during their toughest times. So thank you for making Ochsner different and for enabling our care teams to do what they do every day. I apologize for having to film a video to tell my dad's story, but even 10 years later, it can still be tough for me to talk about. That said, at Ochsner, we are here to deliver exceptional care and make it close to home. But it's not just about the clinical care we provide, but how we provide that clinical care. Tonight, we are here to extend our gratitude and celebrate the difference you and others can make in the lives of our patients at the Ochsner Cancer Institute. This is a place where people come to get well and be treated with care and with compassion. These people are our parents, our grandparents, our spouses, our friends, and our neighbors. And last year, we introduced you to our friend Ben, one of our incredibly brave and strong pediatric cancer patients. I'd like us to check back in with Ben and his family now and let them tell you how you don't have to leave Louisiana to get the very best life-saving cancer care.
Initially, he had a sore throat, which they thought it was strep.
We treated it, and he responded to antibiotics, and he woke up that morning and he's like, oh, my legs hurt. then he started to have a fever later that day. So then we thought, well, maybe this is a strep complication. So we went to the emergency room and ended up being admitted. But as a couple days went by and more tests were run, and that you could tell that the tide was changing, and that we did a bone biopsy, and then we got discharged, got the call the next day, and that's when we found out that Ben was diagnosed with leukemia.
Life changed from that moment on, and a lot of good stuff's come out of it, but that day was this kind of place in time where you knew your family was never going to be the same. It was going to change. And we knew we were going to spend a lot of time in the hospital. So every other day you're going in for a lumbar puncture, you're going under anesthesia, you're seeing your child, these things that you've never seen before. Obviously there's different stuff going on. He's got a port in now, he's been operated on, he's
swollen.
He's
He can't
swollen.
sit up by himself. He can't walk because he can't move all this new weight or this new body that has grown around him.
I don't think there was a day that went by for the first 3 months where we didn't break out and go into another room and just cry our eyes out. Ben really, even during those times, was far more stable and cheerful than Maya and I were.
But he set the tone. I mean, he set the tone for the attitude we were going to have during his treatment.
And Ochsner was amazing. Ben would have a fever. It's like midnight on a Friday night or something, Saturday night. We call the hotline. 5 minutes later, Dr. Falcon's calling us back. Dr. Falcon's already called the emergency room. They have a room waiting for him. They're caring for him, and so the personalized care. They're human beings that also love your kid, and they cry with your kid, and they care for you, and
we've gotten to watch the relationships that they have with other patients and other families. And I mean, the capacity you have to have in your mind and in your heart to be able to give that much to that many different patients with, and families and in all different situations. I mean, they go beyond being a nurse. They go beyond being a child life specialist. They go beyond being a physician. Today is your day.
Today is your day.
Your mountain is waiting.
Your mountain is waiting.
So get on your way.
So get on your way.
I'll be forever grateful. Maya and I have big plans to help the clinic actually as the years go by, because it's just, how can you not? It's unfortunate that more parents are going to have to go through this, and it's such a long, dark journey. They're going to need a lot of help, and we want to help them find a way to get back to some sort of normal life, and Ochsner's been that for us during this whole journey.
What a beautiful family. And it's great to see you, Ben. You're doing well. Before we introduce Chief Physician Executive and President of Ochsner Clinic, Dr. Robert Hart, I want to remind you that you can donate and help families like this tonight by texting the number on your screen. You can make a difference in the lives of thousands across our region who are fighting tonight. So please text now or visit the website on your screen. Now please help us welcome Dr. Robert Hart.
At Ochsner, our cancer care team is saving and changing lives every single day. We deeply care for the well-being of our patients and relentlessly pursue excellence through every step of the patient journey. We are constantly looking for ways to grow and evolve in their mindset and approach to cancer prevention and treatment. And we are always working tirelessly to ensure our patients have more good days. I've personally witnessed the struggles and hardships of cancer inflicts on our patients. I've seen young and old patients alike fight their hardest to beat cancer. And Ochsner doctors are there with them every step of the way. No matter where our patients are in their cancer journey, the wide variety of experts and specialists at Ochsner are ready to help. Whether it's our surgeons, oncologists, hematologists, and pharmacists, or our radiologists, pathologists, genetic counselors, nurses, and all the members of our care teams. These teams are achieving incredible results for our patients every day. From blood, breast, lung, cervical, and head and neck cancer care, to brain, spinal, and central nervous system cancers, the highly specialized care offered at Ochsner is unmatched. And our team's combined clinical skills, the research experience, and commitment to integrative oncology and wellness services truly sets us apart from all others in our region. Let's take a look.
I help oversee cancer survivorship. That involves running a program for cancer survivors, and we weave integrative oncology services into that. Integrative oncology basically runs, normal cancer care alongside with different therapies that can help with quality of life. Now, how many times a week are you doing the yoga now?
4.
Good.
At least 4 times a week.
Okay. Would acupuncture benefit them? Do they need physical therapy? Where are they with mindfulness, yoga, meditation, nutrition? We try to meet the patient where they are and give them the tools to be where they want to be along this journey. And this is a breast cancer survivor right here. I block out 2 full days where this is all that I do. Just interacting with patients, really sit down with patients and their family members, figuring out what's going to be the next best step for them and helping them, get to the acupuncturist or get to the nutritionist. And I also do some administrative work where I meet with my team. And I have an incredible staff. I have a nurse navigator, I have an excellent medical assistant. We have 2 psychologists on staff, and then all these other experts who come in, the nutrition, the acupuncture, meditation, the yoga. We all have to, work together to help patients on an individual level. All right, so how are you doing? How are you feeling?
I feel pretty good.
Feeling good?
Yeah.
Okay. Anne is a breast cancer survivor. When she came in, she's like, I need help to mitigate these side effects because I've got a life that I want to live. She was not herself, and I've known her for a long time. She just has this vibrant personality, high energy. And so, we kind of tried some different things like acupuncture. We did some hormonal therapy, and that worked.
It worked.
Okay, good. She's really thriving, and she's back to herself.
I give myself permission not to worry about anything for that prescribed time.
I think what makes Ochsner different is that we really are running this alongside with the cancer care. And so it's multidisciplinary in its approach. I work with the oncologists, the radiation oncologists, the surgeons. I think what sets us apart is we have these services and we have it all in the cancer setting. The treatment so far has helped you with writing and
yoga. You guys introduced me to yoga.
These patients go through so much. You go through chemo, radiation, just the diagnosis alone. It's cliche, but it's true. No one gets through cancer alone. The way we see success is by changing patients' lives. That's how you measure it.
Nearly 30 years ago, my family was also touched by cancer. My wife, Dr. Susan Nelson, a physician here at Ochsner, was diagnosed with breast cancer. We had 2 very young sons, and we were completely shocked by this diagnosis. As you can imagine, we had a tremendous amount of anxiety about her treatment, about the outcomes, about how this would affect our children. In our time of need, a physician, Dr. Jay Brooks at Ochsner in Baton Rouge, held our family's hands. He stood alongside us every single step of the way, through her mastectomy, her chemotherapy, and subsequent treatments. Dr. Brooks was there with us, offering a helping, healing hand. I'm so grateful for Ochsner and for Dr. Brooks. I know they are the reason that we had the best possible outcomes, and the reason why Susan and I will soon be celebrating our 37th wedding anniversary. I feel forever indebted to Ochsner for the care our team provided my wife. Together, we can all continue to change and save lives, just like my family's, and set the bar for the future of cancer care today. I'm extremely proud of the innovative, groundbreaking approaches the Ochsner Cancer Institute and the Benson Cancer Center are bringing to improve the health of our patients each day. So what exactly does it mean to be a member of the Ochsner Cancer Institute care team? To answer that question, Let's take a look at a day in the life of some of the experts on our Baton Rouge cancer team.
Y'all, what do you think is the most number of times you've ever talked to a patient?
I would say 365 days in a year, probably double that. Say about double that.
I get a phone call from a patient, one particular patient, 5 days a week.
Really?
Yes, 5 days a week. And it's usually around the same time.
You're part of their morning coffee and paper. This role allows us to provide so much education for our patients and explain to them what the chemotherapy avenue is for them and what all it involves.
Right, because it's a lot.
It is a whole lot. It's
more
very overwhelming.
We work closely with our doctors, but we also work closely with surgery, with radiation, with radiology. If they have questions, we're the person that they're going to reach out to.
And then they know that when they call us, we're going to answer.
So just imagine going somewhere else, another facility where they don't have navigators.
True, I wouldn't want to be a patient going somewhere else and knowing what we know, that what we have to offer.
Right. You know, we develop relationships with these patients, and it's not like we see them one day and then they're gone. We get to know them. We get to know their families.
It is rewarding to know so many lives that we have touched, even if it's sometimes only by a phone call.
Right. During COVID, this one patient, the daughter called me and asked me if we could arrange her graduation to be outside.
Yep.
And these family members came in all of their cars. They were in the parking lot. They had posters and bells and bullhorns. And when she exited the building after her last chemo, the fans just erupted with their horns and bells and whistles, and she was crying. And so, it's gonna make me cry. The daughter came and hugged me and thanked me. And that just is so touching to know that we made that day for that patient.
Right. It makes a big difference.
I think it's so fortunate that we have this department to provide that care for our patients from beginning to end.
Thinking back on it now, I couldn't imagine, like 3 years ago, I saw myself being an infusion nurse until retirement, but then now it's like, oh my gosh, this is the best job that I've had.
I'm so glad I got you in with me, and then we got Chelsea in with us, because in this role we have to trust each other. We have a sisterhood.
That's true, yeah.
That we may not have had otherwise.
The Ochsner Cancer Institute and the Benson Cancer Center team is extremely diverse when it comes to the specialties and expertise that we all bring to the table. But one thing that is consistent throughout our team is our collective focus on preventing, treating, and curing cancer. Our commitment to this singular mission has never been stronger, and we are proud of the successes we've had over the last year for our patients and our communities through your generous support. Every day, our cancer care team demonstrates their strength and compassion, helping those most vulnerable and in need of support during one of the toughest times of their lives. And we aren't slowing down. We continue to attract more strong talent to our region, brilliant physicians and surgeons who bring even more capabilities and innovative solutions to every community we serve.
I grew up here in Chalmette, went to Holy Cross for high school, been in New Orleans my whole life. I've done a little bit of everything between military, pharmaceutical sales, nonprofit, alumni work, and bartending, and I am currently a full-time bartender. My healthcare journey is a long and crazy one. In 2003, I was diagnosed with chronic myelogenous leukemia. Since then, I've had 2 heart attacks. At Ochsner Medical Center, I had quadruple bypass surgery. During that, they found a lesion in my throat, which was throat cancer. A few months after I finished the throat cancer treatment, they found a cancerous lesion on my tongue and removed that along with about 1/3 of my tongue. It's been quite a little bit of fun that I've had these last few years. I've been on 2 clinical trials for 2 of the medicines for leukemia, and now I am under the wonderful care of Dr. Finn here. I feel like I'm in really good hands with her. Fitness has always been important to me. Until I was diagnosed with leukemia, I was an avid runner. I walk daily. I do 2 miles plus almost daily. I do a quick full body workout. I'm not trying to impress anybody, with the weights at least 3 times a week just to, make sure that I stay healthy. I joined Ochsner Fitness Center. As soon as I could, I joined right back up. I tend to use Heritage Plaza more often just because I live right there. But I do love coming to the big club on weekends, spending a little more time. I love the upstairs. I love doing the track up here. I love doing the free weights. And, sometimes I do the machine. I try to alternate. Every time I come, I try to do different stuff. But I always go in the steam room, the sauna, and the spa. I firmly believe in the sauna and the steam room, not just for the relaxation part of it, but actually for the health benefits. Even though, I'm overweight, I have heart disease in my family, I am alive today because I do come here. I come here, 5 times a week, 6 times a week sometimes, if not every day. And, I'm hoping to belong to the club for a long time. I'm just not ready to give up. I enjoy living. I enjoy being in New Orleans. I enjoy hanging out with my friends and family. And, I'm in love with my new grandson. So, I'm not planning on going anywhere anytime soon. I'm just going to keep on pushing through all this craziness.
At the Ochsner Cancer Institute and the Benson Cancer Center, we not only focus on treating someone's cancer, but on caring for the whole person throughout their cancer journey. In addition to our oncologists, we have an integrated team of specialists dedicated to supporting our cancer patients. This team of psychologists, nurse navigators, dietitians, financial counselors, social workers, acupuncturists, physical therapists, and many others play a critical role in minimizing the impact of cancer on our patients' daily lives. Facing a cancer diagnosis can be devastating, and cancer treatment is not only physically challenging, but can take a toll on your mental well-being. It's our goal to give our patients more good days during what is arguably the most challenging time in their lives. At the Ochsner Cancer Institute, we look at cancer care across the full continuum, from prevention, screening and early detection, diagnosis, treatment, and into survivorship. Working together, this team is what makes the difference in preventing, detecting, and curing more cancers year after year. They make the day-to-day battles winnable for our patients, and they're doing this everywhere we serve across Louisiana and Mississippi, ensuring patients don't have to travel far to get the care they need.
So whether you're a family member, a patient facing a new diagnosis, or a survivor coping with the side effects of treatment, Ochsner's local, regional, and destination approach means that you and your loved ones can receive world-class cancer care close to home. When you're at the beginning or even in the middle of cancer treatments, such as chemotherapy or radiation, you want to be surrounded by those you love and those who, you hope, love you. And we want our patients to be connected to their loved ones throughout their journey, without the added burden of having to move or travel hours away from home to receive the treatments that they need. Sometimes, though, you do need to travel to our destination center here in New Orleans at Ochsner Medical Center or at Ochsner Baptist for complex surgery or reconstruction, minimally invasive surgical approaches like robotic pancreas, lung, throat, or gynecologic surgery, or treatment for leukemia, lymphoma, or myeloma that may even involve a bone marrow transplant or soon CAR T-cell therapy. Or maybe you need to meet with one of our specialized teams, such as neuro-oncology for a brain tumor, our skull-based team for a sinus or nasal cancer, our breast cancer team featuring outstanding surgical oncologists and reconstructive surgeons capable of the latest techniques, or our world-renowned neuroendocrine tumor team at our Kenner campus for those rare tumors. Our teams truly make the Ochsner Cancer Institute unique. And we're also proud to work with your hometown physicians to provide such complex episodes of care that are only available here. or to support you and them with second opinions, to connect you to clinical trials, or even to deliver comprehensive offerings up to liver transplantation in select cases of metastatic colon cancer through our metastatic colorectal cancer program. Most patients with common cancers can and should get treatment in their communities, though. This is why we continue to make huge investments in developing our subspecialty expertise and multidisciplinary teams at our local and regional cancer centers, such as Baton Rouge. Earlier this year, we announced the continued expansion of the Ochsner Cancer Center in Baton Rouge. Through this investment, we will provide a new pharmacy for patients involved in clinical trials, as well as additional space for exams, consultations with our expert teams, and treatment. In June, we also celebrated our first full year treating patients at the state-of-the-art St. Tammany Cancer Center. Through the increased capacity and expanded services we've established at this beautiful new facility, we are providing world-class cancer care for patients and their families across the North Shore. Now let's take a look at one of our North Shore team members right now.
Swallow for me, please. A typical day is a clinic day. I come in the morning and I have a patient list that I need to go through, and I start seeing my patients, talk to them. A lot of them might be chemotherapy patients, and then after lunch it might be just follow-ups or new consults. That's all the nodes in that area. A medical oncologist in a dictionary would look like a doctor who is providing cancer care, but also with a compassion that needs to go with that to take care of the whole patient. Not fingernails, but the palms, okay. I do general oncology, but I do have a lot of interest in breast oncology, and I think that's a very good example of multidisciplinary care. We are the medical oncologists. We have a role to play. Surgical oncology has a role to play, as well as radiation oncology. So these are the three disciplines that are all involved. At Ochsner here, what we've tried to do is to have all these services together under one building, and at the same time, we are starting a multidisciplinary clinic for breast cancer patients. So imagine that somebody gets diagnosed and they get referred to us. We try to see them the same day. The patient would come in, we would have already talked about that patient from what we know, and then the surgeon would see the patient, I would see the patient, and then the radiation oncology would see the patient, and we'll come up with a plan together.
What would cause someone to have thyroid issues?
So the thyroid could be, well, this is just to check for an enlargement. Thyroid issues could be they're mostly autoimmune. When I was in residency training, I wasn't really sure what specialization was for me, but then I started seeing patients and just became aware of cancer being so common. And I was in New York and I did a rotation at Sloan Kettering, which is a fantastic cancer hospital. And I was just drawn to how much passion everybody had for their patients and how a great multidisciplinary team approach could save lives. And that's really when I got really drawn to oncology. Because it is a chronic disease. We are with the patients for a number of years, and people will be surprised to know how much we learn about the patients and their families and how close we get to them.
I believe, have you heard of him?
Yes, yeah.
So someone...
I'm constantly in gratitude of patients, and because they would surprise you. They would bring fresh vegetables from their garden, or deer meat, or fish that they just went fishing. And just to know that they think of you and remember and want to bring you something and share that important part of their life with you, it just is very humbling. I'm so grateful to do what I am able to do to help my patients, and I learn from them every day, and I really want to thank them.
Every day, the Ochsner Cancer Institute and the Benson Cancer Center are relentlessly seeking solutions to prevent cancer and diagnose it early in order to give our patients the best chance at recovery. We're forging new partnerships, such as the one we announced in June with Gayle. Through this partnership, we have gained access to Gallery, Gayle's multi-cancer early detection blood test, which can detect more than 50 different types of cancer. This test is now available in all of our regions, and we're launching multiple clinical trials with a focus on improving early cancer detection rates in Louisiana, particularly in our underserved communities. We've announced our partnership with Southern University this year to create the JAG Mobile, a mobile health unit that travels to neighborhoods surrounding the university to treat residents and offer screenings. And through our ongoing partnership with Chevron, we're directly addressing one of the top health problems facing Louisiana. This valuable partnership is contributing to the growth and expansion of our world-class lung cancer screening and smoking cessation programs. We're proud to deliver the highest quality cancer care, and we are continuously amazed and humbled by the achievements of our world-class cancer team. Take a look at this video to learn more about who we are and what we're doing every day for patients in your state and beyond.
If one puts the same amount of time, the same amount of effort in any other line of endeavor, they will be monetarily much farther ahead than going into medicine. But there's a compensation in medicine that money can't buy.
I think the greatest contribution that this organization makes is you people.
What we do know about cancers is that if we can keep them away from us, if we can diagnose them at early stages where they're cured mostly by surgery and don't need more systemic therapies like the chemotherapies and immunotherapies, those are the patients that are more likely to be cured and do well for a long time. While I love that I'm able to do my job, I would certainly love to see patients not ever have to come into our clinics with more advanced cancers. We can accomplish that quite a bit of the time with prevention.
We have a new technology now with a robotics system where we can go in and diagnose the smallest nodules that previously were really inaccessible and that some might decide to just monitor. But we are now going after these nodules to hopefully find cancers at an earlier stage to move them on to treatment.
After the wonderful care and compassion I received at Ochsner, I'm not going anywhere else. I'm not. Mind made up.
If at the end of each day you can look back and say, what have I done today? How have I helped others? How have I improved myself? If I have done this, there is a sense of accomplishment. And this is a tremendous satisfaction.
Remember, you can donate tonight to Ochsner's Cancer Institute and the Benson Cancer Center by texting the number on your screen. And don't forget to purchase a raffle ticket to win this beautiful Mercedes-Benz GLC.
Each year at this event, Ochsner honors an outstanding oncologist and a leading member of our community. These are people who have dedicated themselves to helping others with cancer. So please, let us introduce you to this year's honorees.
So TGen was a very early entrant into the whole world of genomics, coming right out of the development of the first human genome and carrying on since then. Understanding the genome and then how it impacts individuals' health and disease states. So our goal and our mission has been to use that information to help people best manage their health and to help initially cure disease. But to really impact human health and to really fully achieve our mission, we need clinical partners to take the things we develop and create out into the world of patient care. And so we partner with a very limited number of health systems, and Ochsner was one of the groups at the top of our list, primarily because the cultures were very similar. And just the commitment to care, the commitment to making their community a better place, it's been amazing to work with Ochsner. Early on in our early discussions with the Ochsner leadership, Pete November played a really critical role in demonstrating the commitment to patient care and to seeing what we brought to the table. You have to remember, this was before precision medicine was ubiquitous. He really did see that there was an opportunity to impact his community. So we're grateful to him. In addition, Dr. Matrana, who has stepped up, very eager and just done a wonderful job of staying committed and making sure things worked out the way they need to so that these benefits could accrue to the patients. They always say local research benefits local patients first. A lot of people travel long distances, especially when it's, a life-threatening diagnosis. So to have the ability to keep people closer to home for those same treatments is just incredibly beneficial. It's incredible to be able to work with individuals who are really motivated by a purpose. It looks like a miracle to the outside world, I think, when you see something so miraculous happen. But these people have been doing this for so long and improving their methods and working with clinicians and other colleagues to improve upon that. So these miracles that happen, they happen every day. It's so rewarding in and of itself, but then to be recognized by a group like Ochsner for what we're doing, it's incredible. So we're so grateful. Well, I think the real miracle workers are the donor community. We couldn't do what we do without the support of not just collaborators like Ochsner, but the donor community who really wants to make a difference, who wants to really push the envelope and try things out that are innovative, that have not been done before, and that really want to see an impact in healthcare. So these miracles happen every day, but it's really because of the support from people like the ones here at the gala tonight.
Presenting this year's award to Tess Burleson from TGen is Mrs. Gayle Benson and Pete November.
I like to tease other doctors my age that we're all seasoned and seared. We're like a bunch of old battle-hardened warriors ready to go to fight for our patients. And we feel we're prepared for anything that can walk through the door. But I was totally unprepared for that night last May when I had to walk through that door with my wife. Kim, who is faculty at the Tulane Law School, had been sick for a few days. We had been to the local hospital where they ran a bunch of tests and told us that she was dehydrated. Little did they know that she had a brain tumor, the kind that John McCain had. We checked into the main campus at midnight on a busy Saturday night. And by 1 a.m., we knew her diagnosis. My wife was operated the next day, and the care was impeccable. They were an impeccably trained team of medical professionals. But to me, they were like angels who came down from heaven and literally saved her life that day. I didn't realize how close she was to dying until after the fact. After her discharge, we got to go to Houston at MD Anderson, and we talked to physicians at Mayo Clinic and Duke University. And none of these places had anything better to suggest than what we had here in New Orleans. As a physician, I'm usually on the other side of the table, but this time I had to experience the patient's perspective, and it was scary. I got to feel the sadness, the pain, the fear that my patients have been describing to me all these years. And that experience has fundamentally changed me as a physician. I totally understand, and I have firsthand experience now of the anguish and the disruption that a cancer diagnosis would bring, not just to the patient, but to everybody around them. So a journey still continues, and it is a tough and challenging journey. But the constant outpouring of support and encouragement has made it much easier. And for that, we're both very, very thankful.
Presenting this year's award to Dr. Chris Theo is Mrs. Gayle Benson and Pete November.
Thank you to everyone who has joined us virtually and in person this evening to support the patients and programs of the Ochsner Cancer Institute and the Benson Cancer Center. Together with our team, you are directly supporting our ability to fight and prevent cancer. And by supporting this event, you are helping real people get through the hardest time in their lives. Helping people have more good days is really what it's all about. Throughout my 13 years at Ochsner, I've witnessed hundreds of people beat cancer. And the joy in their faces when they ring the bell or they get that clean scan report is a constant reminder that this is not just a job. It's a calling to help real people. And you saw tonight, these are our friends, these are our family members, our neighbors, whose lives we are truly saving and changing.
In order to give our patients the highest quality cancer care closer to home, the Ochsner Cancer Institute and the Benson Cancer Center are committed to researching and delivering advanced technology and treatments such as precision therapies, early tumor detection programs, and the largest clinical trials network in Louisiana and the Gulf South. We offer breakthrough therapies and technologies at Ochsner that you won't find anywhere else in the state. Innovations like our new single anesthesia event procedure, allowing for the biopsy, diagnosis, and removal of lung cancer, all under one anesthesia event. Our new Gamma Knife Radiosurgery Center for brain and skull-based tumors, and many others are what make Ochsner a destination for cancer care.
These are treatments and research efforts you can find right here at home, thanks to our top-notch clinical and research teams. Whether you're in New Orleans, Kenner, Baton Rouge, the North Shore, Lake Charles, Lafayette, Shreveport, Bay St. Louis, or Meridian in Mississippi, we have the capabilities you need, no matter where you are in your cancer journey. Now please join me now in watching some of our patients in the Benson Cancer Center with a special visitor.
You know, we all know that cancer is complex, deeply personal, and touches everyone in our community. Ochsner provides our community and loved ones with compassionate care so they can get through the most challenging time of their lives with dignity, empathy, and hope. And not only that, but Ochsner is the destination for cancer care and the home for state-of-the-art facilities, medical advances, clinical trials, and innovations not available anywhere else in the Gulf South. For me, it was these two things that drew me and my husband Tom to support cancer care at Ochsner. Ochsner's commitment to a people-first approach while providing the highest standards of life-changing medicine. We knew we wanted to be part of that. The Benson Cancer Center is going to continue to look forward with bold research, innovations, and solutions to stop cancer in its tracks. Ochsner's team of specialists will work tirelessly every day to help minimize cancer's impact on patients' lives. Good morning. How are you? Good morning. Good. May I come in? Yes, ma'am. Thank you. I just want to shake your hand and say good morning. The patients at the Cancer Center are the people of our community. They are our families, our friends, and our neighbors.
I've been coming here for quite some time now.
Well, I'll keep you in my prayers.
Thank you.
Thank you. And they are facing one of the toughest times in their lives. But at Ochsner, they know they are in a place where people come to get and stay well.
Thank you for having this center here. We got great staff.
Thank you.
It's, you know, when you got cancer, it's great to come to a place that takes good care. So
Thank you.
We really appreciate what you do.
I'm humbled to be able to do it. Thank you.
That's really nice.
They know that Ochsner is there for them. And when patients at the Benson Cancer Center go into remission, the joy on their faces when ringing that bell is like nothing else. It is such an honor to watch Ochsner's team take that journey with them. People's lives are being changed and saved every single day, and I am so proud and humbled to be part of their journey.
Thank you all again for joining us tonight to celebrate the incredible accomplishments of the Ochsner Cancer Institute and the Gayle and Tom Benson Cancer Center. We're always improving and advancing in our approach to cancer care, and I have great confidence in all that this amazing team is set to achieve in the coming weeks, months, and years.
Together, we can and will make miracles happen. Thank you all for believing in us and supporting us in our mission.
Thank you, Pete and Mrs. Benson, and thank you for joining us tonight. You can support cancer patient assistance funds by texting or calling the number on your screen. Your support will also help fund Ochsner's research to battle these silent killers like melanoma and pancreatic cancer and many others. And remember, the dollars you donate can go towards simple things like transportation costs for patients to get to their treatments, as well as exciting cancer trials that can help us all. So donate anything you can, we'll take anything, and let's win this war together.
And if you want to support Ochsner cancer patients, text the numbers on your screen now. Tune into this channel Monday to find out who wins the Mercedes-Benz. Thank you again for joining us tonight.